As mentioned, my name is Carla. I work with Capital Care, which is located in Edmonton and area. We are one of the largest publicly funded continuing care organizations in Canada. So next slide, please. So today, the issue I'm discussing relates to social connections during the pandemic. So most of our residents are unable to connect to family members using technology independently. The majority of long-term care residents have dementia, and the average age is in their 80s. So many of them have never used video calling apps before and don't own tablets or iPhones. So those of our residents who have dementia, of course, also have short-term memory loss. So they have a difficult time learning complex new skills, like learning how to turn on and use a tablet or a smartphone. There's also an enormous amount of staffing resources that are required to schedule, organize, and facilitate connections during the pandemic. So staffing resources include things like scheduling family members into visit time slots according to the availability of staff, the availability of technology, and around other activities that are happening in long-term care. Also communicating to families their visit date and time, helping families learn how to use new technologies, since many family members are themselves older adults. Setting up residents with the device and starting calls. So different types of visits also have different requirements that staff have to inform family members about. So for example, outdoor visits have very specific rules that were outlined by the Chief Medical Officer of Health that must be adhered to. So family members need to be informed of those rules prior to the visit. And of course, those rules are subject to change. Next slide, please. So just as an example, in one of our larger facilities, we have 276 residents. So if we were to facilitate just one 30-minute video visit for each resident in a week, it would take 138 hours or 6 straight days to complete if we had a single staff member facilitating visits 24 hours a day. And that doesn't include any of the time taken to schedule visits with families or get residents ready for visits. Next slide, please. So there's 2 angles that could be used to tackle this issue. The first would be developing a technology that is so easy to use and accessible that residents with cognitive impairment could make calls to family members or receive calls from family members without the assistance of staff. So the technology would have to work off as existing resources in the home or be something that could be easily purchased by family members. The second angle that could be used to tackle this issue would be technology to help organize and facilitate the connections to reduce the staff time and involvement. So in the absence of technology that can be used by residents without staff assistance, staff are required to facilitate all connections, and that includes the scheduling and the organizing. These are really large tasks when we're talking about hundreds of residents and hundreds of family members trying to connect each week. Next slide, please. So in terms of our current practice, right now we have a central phone line and an online request form that family members can fill out to request a visit. Not all visit requests come through this line. Sometimes family members call the centers directly. Sometimes residents are requesting visits, so residents ask staff if they can help facilitate a visit. Staff at the centers receive requests each day, and then they have to develop a schedule based on family preferences for specific dates and times. They also have to develop a schedule based on staff availability, the availability of tablets and phones, and resident availability. Then the center staff have to call families to confirm the details of their visit, including obtaining any relevant user information for the tech support and supporting family members who've never used those tech apps before. Each day the visit schedule is circulated and staff are assigned to help facilitate calls and visits. So for outdoor or window visits, for example, this involves staff getting the resident dressed and portering them to the visit location. For video calls, staff typically make the call for the resident and ensure that the call is working. Some of our residents actually require assistance during the entire call to help them stay focused and sometimes to hold the device. Some residents also have trouble hearing the tablet and they require assistance from staff to understand and facilitate the communication. Next slide, please. So in terms of impact, In talking to our recreation teams, some of them are spending upwards of 80% of their days organizing and facilitating visits between families and residents. Minimizing the time that they spend managing visits for residents means that they can spend more time engaging residents in recreation and leisure activities, because they are not doing that when they're doing the visits for residents. Next slide, please. Again, still in terms of impact, having resident-driven means of making connections would also increase opportunities for connections, because residents could connect with more family members than our current capacity allows. Next slide. And that's it.